Virchow. Now coming to the classification of inflammation, we have already discussed that there are two kinds of inflammation. One is acute inflammation, another is chronic inflammation. But before starting with these acute and chronic, let's study the different type of inflammation, other types of inflammation. The first one over here is based on the fluid type. That means what kind of fluid is released by the inflammation. That is serous inflammation. In this inflammation, the fluid that is released is kind of a watery fluid. Fibrinous inflammation, as the name suggests, the fluid is going to be fibrous type. The fluid is going to be thready type or stringy type. So fibrous type. If you have done any CD patient, you have seen kind of fibrinous saliva or serous saliva. So these are the type of saliva also we study in the prosthodontics and the complete denture section. So basically now sticking to the inflammation here. Inflammation, if the fluid of the inflammation is watery, then we call it a serous inflammation. If the fluid of inflammation is thready type, fibrinous type, stingy type, that is known as fibrinous inflammation. And such example of serofibrinous inflammation is seen in rheumatoid heart disease, the pericarditis. And this is popularly known as bread and butter appearance. That is because of the watery and the thready fluid in the pericardium. In the heart inflammation is the inflammation or the water or the fluid on the inflammation of the heart here is watery and thready, and that is why it is serofibrinous pericarditis. That is why we call it bread and butter appearance. Now, another kind, if it is pus, then we call it purulent inflammation. It is associated with, say, abscess, cellulitis. In abscess, there is pus discharge. And if it is associated with inflammation, that is purulent inflammation. Then we have catarrhal inflammation. In that, there is mucus and water. For example, in case of common cold, that is a catarrhal inflammation. So basically, mucus and water fluid, if it is discharged, then we call it catarrhal inflammation. Now coming to the main classification of inflammation based on the duration. If this inflammation is immediate, like after a stimulus, there is inflammation seen, that is known as acute. Whenever you see the word acute word means immediate. That means on the spot. There is no time lag. Whenever you see the word chronic, that means it is coming from a long duration. So this inflammation started a long time ago and still inflammation is present. That is the chronic inflammation. Chronic word means that is anything coming from a long period of time. That is known as chronic. So the onset of chronic inflammation is delayed. While on the other hand, the onset of acute inflammation is immediate. The acute inflammation occurs immediately on the spot. So the duration here is short, while on the other hand, for chronic inflammation, duration is starting from a long time. So it is long-lived duration. When you see the cells that are seen in acute inflammation, these are always neutrophils. Neutrophils, guys. Neutrophils are the cells which are multi-lobed cells. These are a kind of WBC, and these neutrophils are also known as polymorphonuclear cells because they have got 3 to 5 lobes nucleus. That is why we call them polymorphonuclear cells. So either you say neutrophils or you say PMNs, it is one or the same thing because PMN, polymorphonuclear is polymorphonuclear cells is another name for neutrophils. These are the polymorphonuclear cells. So these cells are the acute inflammatory cells. What are the cells for chronic inflammation then? These are lymphocytes. See, L for long-lived, L for lymphocytes, and most important cell, most important, M for most important, and M for macrophage. It is a big cell. Macrophage, macro word means it is bigger in size. Phage means it is going to eat the bacteria. So it is a sign, it shows the sign of chronic inflammation, macrophages. And plasma cells, these are the 3 cells of chronic inflammation: lymphocytes, macrophages, and plasma cells. All of the acute inflammation shows the neutrophils, but we have an exception over here, and that exception is typhoid. In typhoid, it is an acute inflammation, but it does not show neutrophil. Instead, it shows lymphocytes, and that is why it shows the relative lymphocytosis. While on the other hand, all the cells of chronic inflammation are lymphocytes, macrophage, or plasma cells. We have exception here, that is the chronic Pseudomonas. Now, as the name suggests, it is a chronic Pseudomonas infection. So chronic Pseudomonas it shows neutrophils. It indeed shows the sign of acute inflammation. What is the cell of acute inflammation? It is the neutrophil. So chronic Pseudomonas is such a chronic disease that shows the sign of acute inflammation. Why? Because it shows the presence of neutrophils. And neutrophils are seen in acute inflammation. So remember one thing, stick to basic. What are the cells of acute inflammation? There is only one cell, and that cell is neutrophil, which is also known as polymorphonuclear cell. For chronic inflammation, it is coming from a long time, long for lymphocyte. Most important being macrophage and the plasma cells. These are the three cells of the chronic inflammation. And we have exception on both sides for acute inflammation, the exception being typhoid, and because the typhoid shows lymphocytosis, relative lymphocytosis, and the exception for chronic inflammation is chronic Pseudomonas because it shows neutrophils. It is the vice versa.